Also happening right now, roughly 200 California healthcare professionals saying that the time for children to be back in the schools is now. They have gotten together, these health officials in Los Angeles County. They wrote an open letter, quote, as pediatricians, internists, neurologists, infectious disease specialists, epidemiologists, psychiatrists, and other healthcare professionals, we strongly support efforts to reopen California schools and believe school districts in Los Angeles County should be compelled to do so as soon as possible. Joining me now is Dr. Houman Hemmati, the ophthalmologist and attending physician at LA County USC Medical Center. He's also one of the leaders of the nonpartisan LA School Uprising Group. Doctor, great to have you with us today. So medically, all of these professionals combined are saying what?
First of all, Martha, thanks so much for having me.
Thank you.
What our entire profession, and I include not just MDs, but everyone else you mentioned as well, and quite a few others, agrees on is what's published in the medical literature, what is now proven as absolute medical fact, endorsed by the CDC, endorsed by even the governor of California, and so many others. And that is that this is now safe time for teachers to return to school. This is an essential time, as students have been out of school for over a year and counting, for students to be back in the classroom for their health, for their academic health, for their mental health, and for the economic health of their families and communities. And we see this as a medical crisis that for kids is far worse than even the pandemic itself.
Yeah, we've talked a lot about the emotional impact, suicides rising. It's a terrible story. But on the other side of the equation, you have teachers, we showed one earlier, who said, you know, I want to be around to see my son get married. I don't want to take this risk. No one can convince me that it's not going to elevate my risk to be in a classroom with 25 kids. What do you say to them?
Well, what I say is look at the facts, right? And back in March, back over the summer even, we didn't have the kind of medical data to answer that question, right? And today, when we look at all the many school districts around the country which are open, when we look at the school districts outside of the U.S. that are open, when you look at private schools within the U.S., amidst cities where the public schools are closed, you see that the number of cases among teachers, among students, has been minimal and has not exceeded the case count in the general population. And so what you're seeing is, by and large, the number of teachers who are infected are probably getting infected at home, at the grocery store, when they go out with their friends, when they do other gatherings, and they're not getting infected at school.
Dr. Hemmati, thank you very much. Great to have you with us today. So that is the story of this Monday, February the 8th. Great to have you with us today.